because I seem to know more about PFAS than anybody in the area. And Andrea went on to found testing for peas. She was able to get PFAS blood testing for over 2,000 people who worked or were at daycare at Peace Tradeport. From that, we learned that PFHXS which is a PFAS that has a very long half-life. It stays in the body for quite a long time. That this was something that was part of the AFFF mixture. So people with AFFF source of drinking water contamination have this kind of unique signature of PFAS in their bodies that, at the time really wasn't understood at all. So I can remember people misunderstanding the blood test results from peas as, oh, well, their levels aren't that high, but they were looking at PFOA, which is not a major part of AFFF. And if you looked over at the PFHXS, it was quite high. A lot of people in the community had levels that were elevated above what you see in the general population. So I worked with Andrea for a few years, and then we helped organize the National PFAS Conference, the first one that was at Northeastern University. We put in a proposal to NIHS to do more work on understanding effects of PFAS on the immune systems of children exposed to drinking water at peas, and also at a community in Massachusetts. And then I got recruited to MSU and I came here. And since I came here, a few communities have learned about, actually many communities have learned about PFAS contamination. So I should have mentioned another thing that I did when I was at Harvard is I was part of a group that wrote a paper using the UCMR3 data. So this is data from EPA that EPA had on PFAS across the country in drinking water. We were able to get that out and published. We found that over 6 million people had likely been served by PFAS impacted drinking water. And we were able to sort of see that people were more likely to have drinking water contamination if the drinking water system was closer to a place that used AFFF for training, municipal airports, wastewater treatment plants. And so that paper really set off monitoring in places, or helped set off monitoring places. Michigan was one place that started doing statewide monitoring of public drinking water systems. And that happened shortly after I came to MSU. And, that's how a lot of communities found out about their contamination. But of course, in Rockford, they had found out a different way. And I think you have a lot of videos of people explaining that situation. And then Fort Smith obviously found out, was one of the first sites in the United States to discover PFAS contamination. So I've been working, with those communities, providing them with technical support since I came to Michigan. I've been working with communities in the southeastern part of the state that had quite high levels detected in their water through the statewide monitoring. I have a small exposure study where we're looking at exposure via drinking water, diet, and the indoor environment. So we know that drinking water is the main way so if you have elevated PFAS in your drinking water, we know that it's a large contributor to exposure. And that's why, a lot of the interventions are focused around drinking water. And so, that's the main focus, but we also know in the general population that the main exposure is through diet. And so the question that comes up in a lot of communities is, if I have my drinking water treated and we intervene and reduce or eliminate, hopefully, PFAS in the drinking water, do I have an ongoing elevated sources of exposure? So for example, through local and homegrown foods. So some communities have been told not to, eat chicken eggs, not to eat the produce in their gardens, if they irrigated using PFAS contaminated water, and so forth. Some communities have found elevated level in deer, in fish. There are fish advisories for many PFAS impacted communities. And right, so this is a important question. So that's one of the questions that we've been really busy working on for the past few years. And then the other, we got that NIHS project funded. And I think what we've recognized, through work on contaminants over the years. I've been working on contamination issues for 20 years now. I know I look young, but I'm not actually that young. So, I've been working in this area for a long time. And what we've found is that, no one research group can effectively help all communities. Not any one scientist can do all the work that needs to be done.